Good evening, ladies and gentlemen, and welcome to this week's Wednesday's Wisdom. I'm Dr. Vitello, and I want to make sure that I give a special welcome to all those newcomers in our group. So I want to say hello to you. Want to give everyone an opportunity to be jumping on here with me. For those of you that are going to be jumping on live, I want to say hello to you. If you are new here, like we've just talked about, make sure you go back. Make sure you go back and you look at our past recordings of our Wednesday wisdom. I put little nuggets each and every single week that we do a broadcast here, so you can start actually taking action to make sure that you take this information and you start putting it into action, that you can really jumpstart your progress, actually living without diabetes and absolutely catapult you towards the ultimate goal, which is what we talk about here all the time, which is reversing diabetes. That's the aim. That's the end game that I want you to resonate with, and I want you to grab that result. You gotta be willing. You gotta be willing to do what you need to do in order to be able to live a diabetes-free life. See, when we talk about the medical literature, and we do often talk about that here on these Wednesday sessions, there's this story that gets woven into research, and that really kind of starts laying out the steps that what living with diabetes is really like. And there's a story that's out there also, which are the steps to living a diabetes-free life. And those are the pieces of the puzzle that I obsess over. It's one of the main reasons why my practice sees the amazing results it does. Amazing stories of people being able to walk away from diabetes, reversing their type 2 diabetes, pulling that information like we do every single week out of the research and bringing it all in one place. And then what we do is we customize it to each individual with a specific plan. And I like telling new patients all the time, you don't need to know every detail that's out there in the medical literature. Like, it's taken me 20 years to sort this out. That's my job. You don't need to know about that. You don't need to memorize all those things. You don't need to know where to find all of this. But I want to make sure that I bring to you some of the latest from research, from the research department, for things that are actually physically out there. And it's really super interesting. One of the most common side effects that we're going to talk about here this evening is that patients with diabetes experience, and it really starts to get set in, is something called kidney disease. Kidney disease is such a common side effect that where I live, if you go anywhere, there's a gas station, there's a church, and then there's this dialysis center. And they're popping up all over the places. And the kidneys are really sensitive little tissue. And when things start going south from them, usually it's just a matter of time before the doctors are taking and talking to you about like things like dialysis or transplant. And not a lot of people like talking about those things. But it's not all gloom and doom. And if you know what you're doing, so the kidneys are one of main four detoxifying organs that I want to talk about here just for a minute. You got your liver, you have your skin, you have your lungs, and then of course you have your kidneys, right? When one of these detox organs begin to kind of start to go sideways, when its function start decreasing, then the other ones are going to have to go up and pick up the pace. In particular, the relationship between your liver and your kidneys is a really interesting one. And for the most part, those two organs absolutely get destroyed over time with type 2 diabetes. You know, we see most people, unfortunately, they have major side effects of diabetes. And one of those major side effects with diabetes is something called fatty liver disease. Well, when you take the liver off of what I call the playing field, because it's diseased, it's not working the right way, it's being affected by diabetes, then that's going to put a higher burden of detoxification, a higher burden of stress on your kidneys. And vice versa. When your kidneys get wrecked, then the liver burden starts to get affected as a result. Those two organs, they're designed to work together, not to actually have them work independently of each other. Anyway, kidney function is measured, and it's what we call filtration rate. Many of you may know that. Maybe some of your doctors are already talking to you about what your filtration rate looks like. Well, when those filtration rates are normal, no one is talking to you about how to protect your kidneys. The doctor certainly looks at it at every single time, and what do? They do a blood test, and they're not giving you strategies. They're not giving you strategies how to make sure that you actually make sure your kidneys survive, make sure that you protect your kidneys. The life cycle of being a diabetic, unfortunately, your organs get affected. There's no way getting around that. And it's kind of backwards when you really think about it. Like, we don't see a lot of preventative recommendations taking place in healthcare. Not today. Show up at the doctor's office and they usually tell you diet, exercise, lose weight, watch what you eat. and you're off with your prescription refills, right? But there's not a lot of preventative recommendations. So it's more of a, if there's a problem, I'll let you know kind of experience. I don't think it should be like that, but that's where we are. What I think should happen is the moment that you're given this diagnosis of type 2 diabetes, which is just a symptom of an underlying problem. That's a topic for another day that we've talked a lot about, but we'll continue to talk here. You know, you should start moving right away into preventative mode on the rest of the organs that always get eaten by diabetes. Modern medicine shouldn't be telling you how to protect your liver, right? They should be. That's what they should be telling you. They should be telling you how to protect your liver, how to protect your kidneys, how to protect your organs. We got to move into the offensive, right? Modern medicine should be telling you how to make sure your kidneys don't, what do they do? That they make it all the way to the end of your life. But for so many people, they have no idea that these organs just get affected by diabetes. They get eaten by diabetes. And for the most part, they they'd be willing to just do something about it. And I know many of you are, to try to protect yourself, to try to protect your organs, to try to make sure that this diabetes doesn't wreck you. And if you're somebody that's been recently diagnosed with diabetes, your job at this point is to figure out how to make sure that you lighten the burden on your liver and your kidneys. Because when your kidneys go south, like we talked about earlier, sometimes they don't respond well. And what are they going to do? Traditional pharmaceutical based diabetes care actually makes that happen. You know, many of you know, I have a big family. We're a huge, big sports family. When we're watching things like football on the weekend, you see those commercials just like I see those commercials. You see almost every other commercial nowadays is some kind of diabetic medication commercial. You know, they come almost all the time. And every single time when you watch that commercial, there's usually some kind of fancy jingle associated with it. But if you really pay close attention, when you see at the bottom of that little commercial, there's this little gray print at the bottom of the screen telling you that if you have kidney disease or you're at risk for kidney disease, then you should avoid this medication or talk to your doctor about the appropriate dosing strategy. Like even modern medicine knows that your kidneys are at risk. So anyway, I have a research article that talks about a simple nutrient called quercetin, and it's pinned here. You guys can take a look at it if you'd like. You know that I'm always going to pull research here, and we'll talk about the research. You don't have to read the articles, but those of you that like reading this stuff, that want to make sure that you're having all of the information, you can go ahead and read this. But we're going to talk about quercetin, right? And it's absolutely stunning impact on protecting your kidneys. And as you go through this battle with diabetes, you got to be aware of what it's doing to your kidneys. The title of the article is called Quercetin Eliminates Diabetic Kidney Injury. And I know that's an absolute mouthful. I actually had to actually look at that a couple of times before I said that here today. Now, that's a pretty bold statement in this article, but the data in this article absolutely backs up that. And what's interesting is that if something that is readily available, like quercetin, and it's extremely inexpensive, if it can help reverse or eliminate, which means making your kidneys disease actually be better, don't you think you should know about it? Right? If it's extremely inexpensive, it can help reverse kidney disease. Shouldn't you already know about it? Like, why do I have to be the first person that you're hearing this from? 100% of diabetic patients are at risk for developing chronic kidney disease. It's not even a question at this point. We shouldn't be surprised when those things happen. We shouldn't be surprised when organ damage happens. Why? Because that's what diabetes does. But for many of you, or for many people who suffer with type 2 diabetes, it's a silent disease. It's a silent disease until it's not. But if you ask most diabetic patients, do you know the value of using quercetin, to protect your kidneys from having them put you on some kind of transplant list or go meet a nurse at the dialysis center? The answer is absolutely going to be almost close to zero. No one's heard about it. Nobody knows this because nobody's telling you, right? And this is incredibly important. And it's so important because I want to make sure that you get the link to this study and make sure that you take this study to your medical provider if you want, and then you can ask them about it, right? See if they have the time to talk to you about it. Ask them, hey, have you heard this? Have you heard this? And see what they say, right? If they're unaware of this article, of this documentation, of this nutraceutical, this supplement, and what it's doing and what it can actually do to protect your kidneys from things like diabetic nephropathy, which is kidney disease, then you're going to probably have to do some, I don't know, I'd call it soul searching about who you're trusting with your health. Now, I don't say that in a mean way, and I hope you hear me when I say that. But if you know my story, you know my personal story, you remember that diabetes has impacted on my own personal family. I'm just saying that if I knew the right questions to ask when it mattered the most for my family, maybe we wouldn't have had to go through what we went through. That's what we do every single Wednesday here, whether we ever meet or not. This Wednesday wisdom is all about, by the way, making sure that I bring you the information that I wish that I had known back then, so my family didn't have to go through the diabetic experience that they went through. Anyway, I want you to click on that link, right? I want you to, especially if you're science minded, right? I want you to read that paper. I want you to go through that paper. If you don't, then just listen to this recording again because it's here for you. Take this information, talk to your doctor about it. If your doctor had no idea about this article, then I want you to pause here for a second and ask why. Why is it? Why is it that the only intervention that they can ever give you is something that you have to go to a drugstore and then you go put it in a cabinet that you have in your house, in your bathroom, called the drug cabinet, right? Like if you are making decisions and you're making decisions about your own health care, then you got to start implementing some of these things. You got to start worrying and thinking about, well, how do I protect my kidneys? How do I protect my organs? Because the normal diabetic treatment plan is, you know what? It's prescription after prescription after prescription. And when, like we talked about it earlier, when we look at those commercials and they're talking to you about if you've got kidney disease or there are problems with your kidneys, consult with your physician or don't take this. If you like this kind of information that I'm sharing with you here, this science-based things that I think that you need to be aware of, that helps protect you, helps protect your body, that nobody else is doing, make sure you go through here, this video tonight, and I want you to put a little comment. Let me know that you're watching this. Let me know that you're taking this information, you're actually applying this information, that you're not just sitting here, right? Let me know that you're doing it. Let my team know. We love going through your comments. We love seeing it. Let me know what you want to talk about. Let me know what you want us to cover moving forward. That's what about these Wednesday wisdom sessions are all about. So I want you to take action. I want you to write these things down, right? If you don't have time right now to make sure that you go through it, make sure you follow up with it afterwards. And I want you to find a place that you make sure that you start writing this down. I also want you to be aware of next time that we have one of our master classes, make sure you get registered for our master classes. It's a series of classes that we put together for free that actually will show you the framework on how to actually live a diabetes-free life, because it is absolutely possible. And we'll talk about those and those strategies for being able to do just that. You're going to learn and find the tools like quercetin, like we talked about here, helping protect your kidney disease. That's invaluable information. All right. I think I talked enough about this for here tonight. So again, make sure that you stay in the loop, stay curious, stay informed, and I'll see you again on the next episode of Wednesday Wisdom. I wish you a blessed evening. We'll talk soon.